I frequently get asked about toddlers and preschoolers who bite. The question is, what can I do to help my child or clients stop biting? Today, we're talking all about biting in young children with and without delays, with and without autism, ADHD, sensory processing issues. It doesn't matter. Today, we're talking all about biting. Hi, welcome back to my podcast. I'm your host, Dr. Mary Barbera, and I've been producing my weekly podcast for over 5 years now with millions of audio downloads and video views on my YouTube channel and on my website, marybarbera.com. If this is your first time here, welcome. I come out with a new video podcast every Tuesday, which you can watch on my website, YouTube channel, or you can listen and subscribe wherever you listen to podcasts. This week, I decided to tackle the important questions around toddler biting. You might wonder whether biting is just a part of toddlerhood, and most importantly, how to stop a child from biting. As both a registered nurse and a doctoral level board-certified behavior analyst, I consider biting to be one of the most dangerous and severe problem behaviors we need to solve as quickly and effectively as possible. Young kids who bite, with and without a diagnosis of any kind like speech delay, autism, or ADHD, often get kicked out of preschool and daycare. Biting behaviors often require more one-to-one support to keep a closer eye on the child, and that one-to-one support can and also should be providing more reinforcement and prompting during free play time. Biting can also lead to more restrictive placements, because if biting can't be stopped, kids may need to go to special classrooms or even special schools that help kids with emotional and behavioral problems. And if a child has a diagnosis of autism especially, they might be indicated to go to a school specializing in applied behavior analysis or ABA. But I don't want to scare anybody here. Biting can be seen in kids who get frustrated, and we just need to not focus on what's going to happen in the future if we can't stop it, because I'm confident we can stop it with some proven child-friendly strategies I'm going to describe today. In case you have any doubt, biting should not be considered to be a part of normal toddlerhood or typical development. It is a dangerous behavior that needs to be prevented and stopped. Human bites are even more serious than animal bites in many cases, because we have different bacteria in our mouths than animals, and the location and force of human bites can lead to infection or even ligament damage. And if you get a bite as a professional or even as a parent or a sibling, you really should go to the doctor, get blood tests, potentially go on antibiotics, and or in some cases get stitches. And while the transmission rates are low, biting can also lead to the risk of transmitting hepatitis or HIV if the child who bites has any of these viruses or infections. So let's talk about happy bites versus aggressive biting. Some parents think that their child is just being playful, and it's a situation where they're biting when they get overexcited. And they call these happy bites versus aggressive bites. And this is an important distinction as we look at preventative strategies. For instance, if a child only bites when they're roughhousing on the carpet or when you're tickling them and they get overexcited, then you can try to avoid these activities and see if the happy bites stop. But whether it's happy bites or aggressive bites, the key is to stopping them. In the last episode of the Positive Toddler Parenting podcast, which we can link in the show notes below this video on my website, I discuss my 4-step proven approach and how to take step 1, assessment, and really begin to see, not just to look at biting, but begin to get a snapshot of a whole child. Also, in next week's episode, we're planning to cover the differences between gentle parenting and the positive toddler parenting approach. So biting could indicate that the child is in pain, and this is something we need to consider. I recorded a podcast interview years ago with Dr. Timothy Bulmer, who's a behavior analyst and an expert in treating severe problem behaviors in kids with autism and other issues. On that episode, which we can link in the show notes, Dr. Bulmer specifically talked about biting in all humans and animals. Biting can be and is often a response to pain and stress. It really helped me think about biting. Kids that bite, whether they bite others or they bite themselves, or even if they bite objects, could very much be in pain or have stress that they're not able to communicate. On the other hand, we can also have what I talked about before, happy, playful biting, almost like the way puppies bite when they get too excited. We're going to cover all that, including how to assess using my 4-step Barbera Method to really tackle behaviors like biting. So getting back to Dr. Vollmer, he said that the research is clear that animals like birds and mammals bite themselves or bite objects when they are stressed or in pain. Hey there, it's Mary breaking in real quick here to share a great free resource. Tens of thousands of parents of young children have already completed the free 10-minute digital assessment that I created. If you have a short amount of time, 10 minutes, go to marybarbera.com/assessment to find your starting point to help children with and without delays or autism. Once again, go to marybarbera.com/assessment. Now let's get back to the show. Self-injurious behavior is described when kids hurt themselves, including when kids bite themselves. This is also similar. I know my son Lucas, who is a young adult now, and he has moderate to severe autism. When he was a toddler with only a diagnosis of a speech delay, he did bite people occasionally, probably before he was even diagnosed with a speech delay. And this was extra scary because back then I wasn't a behavior analyst and I had no idea how to stop the biting. When Lucas was 3, he got a diagnosis of autism and started an intensive ABA program, and biting others was no longer an issue. But as Lucas got older, he bit himself at times, and it took us years to figure out that his self-injurious biting was, like Dr. Vollmer said, due to pain and also due to his startle response. So by treating Lucas with allergy medications, allergy shots, as well as using a beta blocker, which is a cardiac medication for his hyper startle response, which I discuss on another episode on autism and medications with a psychiatrist, we can link in the show notes, using this amazing work of Dr. Murray, Lucas's psychiatrist, we were able to get his biting of himself and all aggression and self-injurious behavior at near 0 levels. So let's get to the 4-step Barbera Method, which also has been called the positive toddler parenting approach or the turn autism around approach. It's my approach that I've worked on for over 2 decades. So the 4 steps include assessment, step 1, planning, step 2. Step 3 is all about teaching or intervening. And step 4 is about using easy data to evaluate. The reason this is so proven is because it is like the scientific method. It's a very analytic process where we can take all behaviors and look at them either individually or all together and to make a lot of progress. So step 1 of my approach is assessment. And when we talk about assessment, we're not diving in specifically right away into when a toddler is biting and looking at the biting, just hone right in. We need to step out, even for a brief period. My assessment, my digital assessment, is now called the Barbera Early Childhood Assessment. It is still free. I said it would be free for the first 1,000 people. Now more than 30,000 people have taken my assessment. It's free. It takes 10 minutes to complete. and it helps you quickly assess a child in terms of self-care, daily activities, language and learning skills, as well as problem behavior. Last week's podcast episode is all about the Barbera Early Childhood Assessment, otherwise known as the BECA, which is still free at the time of this recording at marybarbera.com/assessment, and we'll put that in the show notes in case you're busy and don't have a pen and paper. By completing the BECA assessment, you will get a snapshot of your child's strengths and needs in terms of self-care, language, and problem behaviors. And once we have the BECA assessment done, which will give us this overview and snapshot and scores, we then look at all problem behaviors, not just biting. We really want to tackle biting as probably our number one problem behavior. However, if a child is also banging their heads on hard surfaces, running in the street, and exhibiting other dangerous behaviors, we will need to look at the whole picture and address these major problem behaviors either at the same time or prioritize them too. Now we finally look at the biting. When does the biting happen and why does it happen? There's probably a couple of reasons. One reason kids might bite is, like we described, they might be in pain. So we would need to visit a physician or healthcare provider and get a medical workup. Bring your child in for a sick visit. Don't wait for a well visit to come in a couple months from now. If you're having biting behaviors, the doctor may want to order blood work. They'll definitely want to look in the child's ears, and you probably do also want to make a trip to the dentist so that they can evaluate, because kids with teeth pain might bite as well. I also have some video blogs about how to teach kids to tell us they're in pain and the importance of ruling out medical problems, so we can link those in the show notes as well. And finally, we really want to focus on when your toddler bites and when biting never happens. So step 2 of the Barbera Method is making a plan, prioritizing the most serious problem behaviors, which biting is almost always at the top of that list. We don't want to forget to look at the whole picture because we need to spend 95% of our time preventing problem behaviors, including biting. And if we think about happy bites, maybe they occur when the child gets overly excited, like, again, when they want to wrestle, or even when I'm carrying my toddler and my shoulder looks like something they might want to bite. Or even when a baby is breastfeeding, if they become a toddler and they start to get teeth, they could start biting, which doesn't mean that there's anything wrong, but they do need to get, everything can't just keep going on like the bite didn't happen. So whether you're getting happy bites, aggressive bites, bites during breastfeeding, here's what to do. So first things first, if you are holding a child who is biting or you're very close to them, you need to back away, put the child down. If you're breastfeeding a toddler, put them down gently. You're not yelling, you're being firm. You're saying no or no biting one time. You're not saying, owie, that hurts. Oh, biting hurts. Owie, you're hurting mommy. Don't do that as you continue to hold them. Now, the child needs to see a dramatic change from everything's pleasant, total reinforcement, now I bite, now things stop. Reinforcement stops. Like I said, we do not want to be yelling. We don't want to be explaining. We don't want to use a sing-songy voice. We want to say no or no biting. And for a brief 30 seconds, 1 minute, this is not going on and on. This is no biting. And now, if the child's calm, if the child's crying, you need to calm down. Okay, you want mommy to pick you up? I'll pick you up. But I am going to be careful to not have the child have open access to my shoulders, or, if he bites again while I'm breastfeeding, again, take them off, put them down. No, maybe end the breastfeeding session. You might start to think that if the baby's really hungry, they're going to breastfeed. if they start playing games and start biting, it might just be time to stop. Stop for that session at least. But we do want to interrupt the biting. Make sure if the child's biting somebody else that they're taken care of. We're going to stop the biting. Get the child calm. And then we clear the slate and get back to reinforcement. And when the biting incident is over and 30 seconds or a minute have passed and we're back to reinforcement, we are no longer talking about biting. We're not telling your husband or your neighbor or your sister on the phone about the biting. We're not saying, Johnny, you can't bite mommy tomorrow. That's bad. That hurts. After 30 seconds have passed and you've already stopped the reinforcement for 30 seconds and resumed, the slate is clear and we're back to reinforcement. If we are talking about the biting incident after that, we are spelling it out. We are talking not in front of the child, because 9 times out of 10, if you're talking about biting, the child knows that he's getting everyone's attention and biting is more likely to increase. So you do want to really treat these biting episodes. You also want to keep data on biting and any other problem behaviors to make sure you're seeing a rapid reduction, not from 5 times a day to twice a day. We need to get biting gone as soon as possible. And your goal should be to get all major and serious problem behaviors, including biting, to 0 or near 0 levels for all children, regardless of diagnosis or if they're speech delayed. We have a toddler preschooler course that will help you complete the 4-step approach for parents and professionals who want to help toddlers with and without any kind of diagnosis, because sometimes you need more support to really implement the plan. And if you get stuck, you need a community of support to figure out where you're going, off track and how to get your child to be happy and willing to learn and in a safe situation. If you like this episode, I would love it if you would share it, give me a thumbs up, leave a comment. And if you have any ideas for how we can, what topics you'd like to see covered or how we can improve, always email us at info@marybarbera.com. If you really love the episode, I would love a great review. That'll help us spread the word. And if you can help us by sharing this episode with somebody else, that would be amazing too. I'll see you same time, same place next week.